Your business is in healthcare. Do you want to talk a little bit about it?
Sure. Yeah, I'd love to. I love when people ask.
Yeah.
My eyes just sparkle. We offer healthcare services at the patient's home, sort of like an Uber model for healthcare services in primary healthcare. So medical consultations, laboratory exams. We take the blood samples or other samples and then deliver the results online, and the medications as well. And that's our starting point. But this business model helps us scale and venture into other services. So what's really important for us as well is integrating nutrition and lifestyle coaching as well, since that is a big part of getting healthy for most of the chronic illnesses going on. So wanting to integrate that as well. But at the moment, we're focusing on these 3 main services, which is at-home care and telemedicine, laboratory exams, and pharmaceuticals.
Yeah, I wonder if there are more. There could be I'm just thinking about this now. I used to work at Epic. Do you know Epic?
Yeah, the electronic medical records.
Yes, exactly. And I was on the home health and hospice team. So we did this.
Oh, nice.
And so I went on a few trips where we would go and shadow nurses in the field. And so we got to do some of that. And honestly, it was pretty rough because it was usually people who couldn't leave their house.
Yeah, mobility issues.
So it was kind of sad to see. But I'm curious if there is a use case for normal people that might, people who just don't want to go to the doctor. Because you go to the doctor and you gotta sit in the room and wait for the doctor. It takes you 30 minutes to get in.
Wow, maybe you should be our spokesperson.
Actually,
that's a great point.
And then
go ahead.
You got to think about, you don't need the space anymore. You don't have to pay rent for a clinic.
Mm-hmm.
You just send the nurses or doctors out.
Mm-hmm.
It's interesting.
Yeah, and that's the reason why it's so scalable, because you don't have ties to that physical space. Yep. So you can expand throughout many cities with this model. And from what you mentioned of the primary audience of these services would be people with mobility issues, so the elderly or people with disabilities.
Mm-hmm.
However, it is also a great service for anyone that wants better convenience and faster service. Waiting in line in the clinic, being around sick people, it's just being in traffic. It's just a bad experience. We've all experienced it. And the feedback we've gotten from our patients has been really gratifying, since they love our service, they love our convenience. And a lot of our patients have been just people that have the flu or get dengue or whatever the illness is. At the moment, most of our patients are people with acute illnesses, the cold, the flu, whatever. But we're definitely trying to expand on people with chronic conditions, diabetes, hypertension, that kind of stuff. So that's where our efforts are focusing right now.
So getting just a regular, any kind of doctor visit, turning that into a at-home thing or telehealth.
Yeah, I feel there's a good balance between telehealth and in-person care.
Mm-hmm.
Building the rapport with your doctor and your doctor getting to know you in person is really important. And telehealth fits in when it's follow-up, or it's something that does not require that much time or the doctor to be there with you or do a in-person examination.
Mm-hmm.
So combining both, I think, is the best strategy.
I was in the car and my girlfriend had to do some telehealth thing, and it was crazy. It took 5 minutes.
Yeah,
the doctor was just
it's
boom,
crazy.
boom, 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 boom. Are you having this? Are you having this? Are you having this? She was like, no, I'm seeing this and this and this. And then she was like, okay, here's what you're going to do. Do this, 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 this. At that speed talking.
Yeah, no, it's pretty bad. I've experienced it myself. And I was like, oh, really? I guess that's why it's so cheap.
Yeah, she's in a rush.
They're cramming so many appointments, and the doctors don't really have the interest because it's so much. Mm-hmm. They get overloaded. And that method, telehealth, would be good if you just need an appointment to get a quick checkup of what you already spoke about, or if you need a receta. How do you say that in English? How do you get your medication?
Prescription?
A prescription.
Yes. Yeah.
Yeah. If you need a refill on your prescription, that would be
that's the time for that.
Yeah, that's the time for that.
Much easier than having to be in person.
Yeah.
That's very cool. And so then the licensed nurses, doctors, all that, they would just be able to basically join your network of the company